Hi, Dr. Ahmed with the Brain and Spine Institute. In this video, we're going to talk about a lumbar arthroplasty, otherwise known as a lumbar artificial disc replacement. Now, please keep in mind that these videos are meant for the patients being treated at this practice. Other practices may do things differently. This video provides a generalization, and each patient's experience and outcomes may vary. For a lumbar artificial disc, the surgery is performed from the front of the belly. To gain access to the spine, a vascular surgeon is used to gain access. The vascular surgeon may make one of two incisions: a horizontal incision in the lower part of the belly, which is cosmetically very pleasing, or a vertical incision, and this is really dependent on the severity of the condition, how many levels are being addressed, and the body habitus of the patient. As the vascular surgeon is working, dissection is made through the skin and muscles. The internal organs are appreciated and moved out of the way, paying very close attention to the blood vessels that are running down in front of the spine, and ultimately the spine is exposed. Once the spine is exposed, the spine surgeon will take over. The spine surgeon will find the disc that needs to be replaced, and very carefully the disc will be removed in its entirety, making sure that the vertebrae are not damaged. Once the disc is removed in its entirety, an artificial disc is put in place. After an x-ray confirms good placement of the hardware, the vascular surgeon will close up the incision. Here's an example of a spine model with an artificial disc. In between the vertebrae here, an artificial disc has been placed, and if you can appreciate it, the artificial disc has been chiseled into the vertebrae so that it stays in place. The artificial disc allows the spine to move normal, thus preserving motion after lumbar surgery. This surgery takes about 2 hours. The patient usually is in the hospital 1 to 2 days after surgery. A back brace is given to the patient to wear when they are up and about out of bed. The patient will ultimately come back to the office at 2 weeks where the incision will be checked, and then physical therapy will be started. Physical therapy is used to regain function after surgery. Patients are usually cleared to start driving and return to work at the 2-week mark.